Well, welcome to this month's Health and Wellness Thursday. Today, we're happy to have a guest presenter on exercise guidelines during and after breast cancer treatment. I want to acknowledge our donors, sponsorship through the St. John's Health Center Foundation, and in particular, the Ken Johnson family, who has supported many of our educational programming in memory of Joan Brierton Johnson. Our guest speaker today is going to be announced momentarily. I'm Rebecca Crane-Okada. I'm a clinical nurse specialist and program manager here in the Margie Petersen Breast Center. And we're accompanied by our co-host, Alston Novak, who is the administrative coordinator for Cancer Support Services and the Margie Petersen Breast Center. And I want to welcome Diana Garrett, who is our guest presenter today, with many credentials after her name that are important to recognize her expertise in not only this topic, but in areas related to breast cancer survivorship and long-term recovery. She is Program Director of Physical Therapy Services at the Women's Health and Wellness Institute, which just opened its doors a couple of months ago, nearby to the main hospital. So welcome, Diana. Take it away.
Thank you guys for having me. So I'm excited to talk to you about the benefits of exercise both during and after treatments. Some of the objectives that we're going to discuss today are just general positive benefits of exercise, some of the recommended guidelines for physical activity, the effects of physical activity specifically for the breast cancer population, and hopefully present some examples that you can integrate into your routine. I'm going to interchangeably use exercise and physical activity because I feel like sometimes exercise has kind of a negative connotation to it, that it's something that you have to do, whereas physical activity is something you can kind of integrate into your life and can be really relative to each person. So one fascinating, I think, is that just the amount of research that is looking into exercise and oncology and the benefits of it in specific cancer populations has exponentially increased throughout the years. This is just a graph looking at the amount of research that has been put out there recently. Unfortunately, I don't have the updated data, but we see this exponential growth kind of in the late 2019 to 2020 being put through to show just how much we're looking into exercise and its relationship to cancer. One study in particular showed that among 800 breast cancer survivors, their overall activity levels decreased by 2 hours or 11% after diagnosis, and that only approximately 20 to 30% of cancer survivors are meeting the public health exercise guidelines after treatment. So there's some sort of gap that's happening when people finish their treatments and getting back into the physical activity that they were previously doing. Physical activity or exercise has been shown to be beneficial for cancer prevention and treatment in 7 different types of cancers, including breast cancer, endometrial, kidney, bladder, esophageal, stomach, and colon cancer. Some of the benefits of exercise just in general can have both immediate and long-term effects. So immediately we see an improvement in sleep, anxiety, and blood pressure. Long-term effects and benefits from exercise include brain health, heart health, cancer prevention, as I previously mentioned, healthy weight maintenance, bone strength, and your balance and coordination, amongst others. One area that I'm particularly interested in is looking at the relationship between exercise and fatigue. During cancer treatments, cancer-related fatigue is probably one of the top symptoms that I hear from my patients. And that can be due to the change in delivery of oxygen to the cells during the cancer treatments, which limit your amount of energy that can be created within the cells. And it seems counterintuitive. However, exercise can really mitigate some of these fatigue symptoms because exercise will increase the delivery of oxygen to these cells and allow for more conversion into energy, in addition to increasing your red blood cell count to tissues, which can decrease your risk for anemia. Exercise is also thought to decrease fatigue by decreasing the neurotoxicity from the treatments and decreasing chronic stress that affects the hypothalamic pituitary adrenal axis, a very fancy word for a part of your brain that really manages your stress and cortisol levels. We also see benefits of exercise in terms of pain. Exercise can alter the central processing of pain in your brain, in addition to slowing the pain signaling coming from your peripheral pain receptors. This is there's kind of a gray area because exercise can help overall pain, but we don't want you exercising with pain. So that's when you might want to work with somebody to kind of tailor your exercise program to kind of help combat some of those aches and stiffness type of pain versus having pain during exercise. And we'll kind of discuss that a little bit later also. Aerobic and resistance exercise is shown to decrease some of the symptoms of chemotherapy, including peripheral neuropathy. Exercise has also shown to have benefits in terms of sleep patterns. A study in 2015 showed that moderate intensity walking exercise significantly improves sleep in cancer patients. And what I thought was really interesting about this study is that it specifically said moderate intensity exercise, not high intensity. That can actually kind of rev up your system a little bit more, whereas moderate intensity has been shown to improve your sleep patterns and your cycle. Exercise also has great benefits for your overall heart health. Some acute responses of the heart during exercise includes this cardiac output. So it's the overall amount your blood is pumped by the heart, and an increased stroke volume, which is the quantity of blood pumped by each heartbeat. So what this is just making a more efficient heart. So acutely, right after exercise, we see the heart working stronger and better and is more efficient. And with continued exercise training, we see an increase in your red blood cell count, your hematocrit, and hemoglobin, again, mitigating any effects that might be occurring from anemia. And aerobic exercise can actually increase the heart's ability to pump blood per contraction at rest. So a lot of elite athletes will have a lower heart rate because their heart is just a little bit more efficient at pumping that blood. So it doesn't have to beat quite as fast. It can actually go slower and it's more efficient at pumping out all that blood per contraction. Another great area of benefit in exercise is your immune system. So exercise can actually increase specific immune cells, such as your natural killer cells, your monocytes, and granulocytes. So these are a lot of your white blood cells. In addition, it can decrease the duration of neutropenia. So shorten that time of where your white blood cells are kind of lower. The graph to the right shows that intensity of exercise and the risk of infection are kind of related to each other. That the less intense exercise, so being sedentary, can have an average risk of infection. Whereas when you go further into some moderate intensity exercise, your risk of infection actually lowers because of that stimulation to your immune system. But if you go too high and you go too far into exercise and over-exercise, it can actually increase your risk of infection because it's just more taxing and straining on your body. One specific study that involved breast cancer survivors showed an increase in immune cells following a 15-week aerobic exercise routine. And this aerobic exercise routine included a walking program. So very achievable to have an increased immune system with exercise. Exercise also increases the production of tumor suppressors and inactivation of tumor promoters. So exercise has an effect on the microtumor environment. So if there are cancer cells there, exercise can actually change the environment around those cancer cells to create an unfavorable situation for those cancer cells to progress. Exercise, as we know, has a huge effect on our bones and our muscles. So studies have shown that weight-bearing exercises have significant effects on both femur and spine bone density. This is based off of what's called Wolff's Law, which is where bone will lay down more bone where it's stressed. So every time that we are walking and we make an impact onto the ground, there's an equal force that goes up into the bone as what we push down into the ground. And that force that goes up into the bone stimulates the bone to say, hey, I need to reinforce here, and it can help strengthen bones. So we want to make sure that we're doing weight-bearing exercises, including walking, stair climbing, going up and down hills, so that we can have some force going into the bones to create that bone turnover. Some randomized control trials show that moderate intensity exercise lessened bone loss, specifically in breast cancer survivors. And follow-up trials showed that increased bone mineral density in groups that did resistance training in addition to medication. So adding some sort of resistance training, some weight training, in addition to medication to improve bone density has been shown to be beneficial. Exercise, of course, also increases muscle mass. and its ability to generate force, so just overall stronger muscles. It increases tissue pliability and flexibility by changing the collagen fibers. And one study in particular that has been kind of prominent in the physical therapy world is looking at a correlation between hand grip strength and mortality risk. So, one study that looked at having a higher hand grip strength had a reduced all cause mortality risk. Now, whether it's cancer related or related to falls and balance, we don't really know specifically, but that having overall increased strength lowers the risk of death. This picture kind of just shows the kind of general exercise effects of exercise on cancer cells throughout our entire system. So we think of exercise of, okay, yes, you're definitely using your muscles, your bones are definitely taking some force, your heart is beating, your lungs are having to respire more, you're getting more air into your lungs. However, it also has a systemic effect on kind of throughout the body. And down at the bottom is kind of where we see our little tumor microenvironment. And so, what exercise does is it kind of changes how many inflammatory molecules are running around, changing your autonomic system, changing how the neurovascular system is integrating and talking to these cancer cells to create a more unfavorable environment for cancer cells. So what have the studies shown? Where are we going with all of this? So there's a beneficial effect of physical activity on cancer incidence, progression, metastases, and survival outcomes. So this is where we start to kind of look at, do we try to start to integrate exercise more while people are undergoing their cancer treatments to create a better tolerance for some of the chemotherapy drugs to create some better long-term lasting effects. Um, there's been more than a 60% reduction in tumor incidence and growth in mouse models that exercise. So they took these little mice and forced them to go on their wheels, on their little treadmills. And what they saw was a 60% reduction in cancer incidence and growth in those specific mouse models. Exercises also showed an increase in density and maturity of tumor vasculature. This seems a little counterintuitive that you would want more vascular structures to go into the tumor itself. However, if you're undergoing cancer treatments and chemotherapy, what that means is that it can actually deliver more of those treatments to the tumor and have a greater effect potentially on them. Overall, exercise has improved health-related quality of life and cancer-related symptoms, which we'll get into next, and has a potential for improved response to therapies. Some of the symptom-based changes that we've seen with exercise is that it improves your overall physical function. It improves your social function, able to get out more and interact with the community, decreases fatigue, decreases anxiety and depression, which leads to improved overall well-being. Decreased sleep disturbances. We talked about how exercise can actually help modulate that sleep wake cycle to help people sleep better, decreases overall pain, and can improve your cognitive function. Some of the things that we want to take into consideration when we're starting an exercise program is to, first to avoid inactivity. We want to keep moving, but we also want to consider your prior exercise history. I've never run a marathon, so I would not think I'm going to just start running right now. I would want to work up to it of, increasing my walking, increasing my hill climbing, increasing my pace before I start to just go into a run. We want to allow for appropriate healing after surgery, always getting clearance from your surgeon before starting an exercise program. We do not want to exercise with extreme fatigue or anemia because then our body is being stressed too much. We know that exercise can help with fatigue, but when you're dealing with extreme fatigue, it can actually be a little bit harmful because it's just too much strain and stress on the body. We want to consider our immune function, and that might be of avoiding gyms when you have low immunity going through chemotherapy, maybe exercising independently outside, being careful with swimming in the ocean when there's high levels of bacteria, and always consulting your physician prior to starting an exercise program. So here are the guidelines. What are we supposed to be doing? So the American College of Sports Medicine and the American Cancer Society and the National Cancer Institute all came down into a table and spoke about what do we need to do to put out there for exercise guidelines for our oncology patients. And they are the exact same guidelines as it is for anybody who is not undergoing cancer treatments. We really want to strive to get aerobic exercise for about 150 minutes per week of moderate intensity or 75 minutes a week of vigorous intensity. We want strength exercise at least 2 days a week, working those large muscle groups and doing some flexibility 2 days a week at least. And these can all be kind of incorporated and gathered together. If you're doing strength training, you're still going to get some aerobic activity with that. Your heart rate is still going to elevate. So that counts in towards your overall aerobic exercise. This doesn't have to be kind of separated out into different days. So moderate activity is working hard enough to raise your heart rate and to sweat, but you can still carry on a conversation. We typically look at using a target heart rate of 50 to 75 to 70% of your maximum, whereas vigorous activity is obviously going to be a little bit harder to carry on a conversation, and that's looking at 70 to 85% of your maximum. The good thing is that most of the research that's out there is really supporting moderate activity. So I just say ignore the vigorous activity. Let's just focus on moderate. So in order to monitor your heart rate, you can either use the equation of your maximum heart rate, which is 220 minus your age. So if you're 40 years old, your maximum heart rate would be a 180. So a target heart rate would be 50 to kind of 85% of that. And I have a graph on the next page that you can kind of take a little screenshot of. Your heart rate can be monitored manually, using the 2 fingers on the inside of your wrist, or using technology such as like a Fitbit or an Apple Watch. They're really pretty accurate. So they're a great way to invest into your exercise. This is a nice little chart to look at your target heart rate zones. So again, if we use the example of being 40 years old, the maximum heart rate that we're looking at would be 180 beats per minute. So a target heart rate zone for moderate exercise or activity would be 50 to 85%, which would be in a range between 90 and 153 beats per minute. So that's kind of where you're hoping to get at, and don't necessarily need to sustain it there the entire time. I actually like to encourage people to do things in intervals. If exercising for 30 minutes a day is too much and it's hard to get in, then break it up. Do 15 minutes in the morning and 15 minutes in the evening. It all adds up. You don't necessarily have to do one full bout of prolonged exercise. Some examples of different intensity exercise is listed here. Again, we're hoping to do more of a moderate intensity. So that might be some brisk walking, biking with some hills, some gardening, although I think sometimes gardening can get into that vigorous intensity depending on what you're digging up. Yoga, doubles tennis, or pickleball, water aerobics. And this is going to be all relative. If somebody is relatively sedentary, then doing some light housework or going bowling or doing Tai Chi might be considered moderate intensity for them based off of their heart rate. These are just kind of general examples, but they always need to be tailored to you specifically. So strength training is super important for your muscle health, your bone health, even your cardiovascular health, because it does increase demand and stress on the heart and kind of helps condition the heart. So different types of strength training can include resistance bands, those kind of TheraBands. You can use weights or water bottles or canned goods or bags of flour or a small child and throw them around and add some weight to things. Or you can just start with your body weight, moving from sitting to standing repeatedly. When you go to stand up, you're essentially doing a squat. And when you go to sit down, you're doing another squat. So doing 10 stand-up sit downs, you're getting about 20 squats in there. And that's great for your body and great for your muscles. And you can add holding onto a book or a computer to add some weight and resistance to it. But we want you to kind of start slow. Build up the strength. Don't start with the heavy resistance because that's where you can get injured, but kind of build things up. We want to aim for 2 to 3 sets of 8 to 12 repetitions. So doing standing up, sitting down 8 times, take a break, do another set, stand up, sit down 8 times. So some examples, we already talked about kind of sitting to standing, which is essentially a squat. You can do push-ups with modifications. You can do push-ups on walls. You can do push-ups on a countertop. The lower you go to being horizontal, the more difficult it'll be. So maybe you start at the wall with your hands in front of you and you start to lower into a nice little push-up. I love a good bridge, or I call them Jane Fondas, where you are lying on your back and you're lifting your hips up to the ceiling. You can change this by adding your feet onto a bench, or put your shoulders on a bench, or do it on one leg, or do it up and then lift one leg while you're up. There's many different variations that you can make this more difficult or easier. And then arm strength, we can do some overhead press, some little bicep curls, triceps, bent over rows. All of these can be done with heavy water bottles if you don't necessarily want to buy weights, or you can do them with a TheraBand also. Just a couple clinical pearls for exercise. You want to slowly work up to building tolerance for 30 minutes of exercise. Like I said, you don't have to start off with 30 minutes. Maybe start with 10 minutes and try to do 3 sets of 10 minutes of exercise throughout the day so you get that 30 minutes of exercise. If you feel pain during exercise, we really encourage you to stop and kind of consult with your physician or your physical therapist. Muscle soreness is okay. It may develop 24 to 36 hours after activity. It might not be immediate, but you should still be able to complete normal daily tasks. I know sometimes when I get back into working out after taking a break and my legs are really sore, I can feel it. I can feel it going down those stairs. I'm like, oh, that was a little bit too much. So now I know I need to kind of taper it back a little bit in terms of my activity. That way I don't get too sore, because going up and down stairs is a normal daily task. And if I'm having a hard time doing it, then I know I pushed too hard. We always want to make sure you stay hydrated and nourished as you're working out. It's really important to get more protein. So you can consult with your nutritionist on that also. And if you become dizzy or lightheaded or having difficulty breathing or nauseous while exercising, stop and call your physician. We want to make sure that your body is in the best condition that to be able to tolerate these exercises, and making sure that nothing else is going on that might make this more difficult. And if you're unsure where to start, talk to a physical therapist. I love guiding people through exercise and getting them started on a program that they can kind of take with them. Especially if you haven't exercised before and now you're wanting to start to get into it, it's always great to start with someone who kind of has a background as to the treatments that you've been through and where you want to go. If you have any questions, I'm happy to answer them. Or if you want to email me, that is my email at the bottom. I'm Diana Garrett at providence.org. There's a period between Diana, so it's diana.garrett@providence.org. And thank you so much for having me.
Thank you, Diana, very much. Are there any questions from the group? Go ahead.
Hi there. I have a question. I'm used to being an avid exerciser. I used to teach spin classes, and I'm still doing spin, but only a couple days a week, and playing competitive tennis. So would it behoove me not to do as much? I'm just starting. I haven't had my surgery or anything yet, so I'm new. Because I like, the idea of doing more moderate, but because my body's used to doing vigorous kind of exercise, what do you think? Where would I stand?
It's hard to answer that individually, but I tend to try to use heart rate as my guide throughout exercise. And I think that would probably be a great place to start for you, is to using a heart rate monitor and making sure that you are within that 50 to 80% moderate intensity guidelines. Like you said, if you have a background of exercising and you're used to exercising, what might be considered moderate for somebody else might be considered low intensity for you. So it's all about kind of modifying it to what your level is, but the heart rate is typically the most reliable benchmark to use. So I would go based off that.
Okay, thank you.
What I'm also hearing is that when you're starting treatment or beginning or ending treatment, there's always these questions of recovery after treatment, whether it's surgery or chemotherapy or radiation. So there will be a drop in activity just naturally because of the treatment, whether it's resting more after surgery or just feeling more tired from the radiation. So it's important, I think, to adjust to that and limit your activity to a degree, and then gradually regain that to your baseline. And maybe, Diana, you could speak to that a little bit too. I think what you're saying, I'm hearing, is that this is not to say vigorous exercise is bad. It's where you start, where you want to return.
Mhm.
Yeah, I mean, I think, Becky brings up a good point of that, how your body is going to respond to various treatments versus, chemotherapy or surgery is very individualized and very specific to you. I've had patients who have done CrossFit while going through chemotherapy because that's what their body was used to. And then I've had people that said, it's been a real struggle for me to go for a 10-minute walk. I'm like, you know what? But you did it. That's great. Let's do that 10-minute walk and let's see if you take breaks throughout the day and you can kind of um, do a couple more 10-minute walks. And it's all based on how you feel. Also, there's going to be good days and bad days. There's going to be days where you think that you can go out and go spinning right away, and other days where you're having a hard time getting off the couch. And to give yourself some grace and to give your body that space to heal, but to also keep going so you don't lose the strength.
Yeah, and I would say our goal is always to get people back to their levels before treatment. I think that's always our goal, not to set our sights so high that we can't achieve them, but at the same time, aim high to return to your baseline.
Or better.
Or better,
Or you
yes, that's true.
you take this as a time to be like, I'm going to focus on myself. I'm going to do these things for myself because I want to live a certain way. I want to achieve certain things because, going through treatment is a huge achievement, and quite the task. And if you can do that, then what else can you do? It can be a way to also find yourself wanting more and pushing yourself more in a different manner, which is just so inspiring. And I'm happy to be a part of it and always here if you have questions about what to do.
Diana, does insurance cover a consultation with you?
Absolutely. Yeah. So I am here at the Women's Health and Wellness Institute, which is right around the corner from the hospital. I think it's right over there. And it just takes a referral from a physician for a consultation. We can take tests and measures as to where you're at. What is your cardiac output looking like in terms of exercise? What is your strength? What is your mobility? Are there any things that we need to work on? Anything that we want to maximize before surgery? Anything we want to work on during chemotherapy or afterwards, or radiation? And it's all covered underneath your insurance.
So, Diana, you mentioned children and lifting them and carrying them around, and we face children and grandchildren, and I know my upper body strength is not what it used to be. So whether it's lifting and carrying anything from 8 to 30 or more pounds, what advice do you have, even without a breast cancer diagnosis in the background? But I think there's often a hesitation to lift and carry after breast cancer.
I think, when you have a toddler that's running around trying to climb up on you, the best thing you can do is sit down and let them climb into your lap, let them come close to you, because we're more efficient when you're lifting a heavier weight closer to your body. If you're reaching out to pick up a child, then you're increasing your lever arm, and that's going to be more demanding. So we can actually be a lot stronger if we keep the resistance and the weight closer to you. So having them climb into your lap, and then you can kind of hold them there. And then if you have to stand up and carry them somewhere, they're already nice and close to you. So you're just a little bit more compact and a little bit stronger in this range.
Any other questions? I think this was really helpful and great information. And for those who are viewing this on YouTube, just want to remind you that we have other recordings on our St. John's Cancer Institute YouTube channel. Our website has additional webinars and other information. And if you are viewing this for the first time and need to establish care for a breast problem, you can schedule through our breast health clinic, or if you have a new diagnosis of breast cancer and want to see our multidisciplinary team, the number is shown on the screen there. So I look forward to see some of you again next month or on another recording. We'll be back in September, and I'm doing that one on complementary therapies and wellness after breast cancer. So thank you again for being here today, and we'll end the recording now.